For doing still techniques for the pubic dysfunction, you want to contact the knees and create your force vector directed towards the pubic bone. So you want to guide that force vector towards the pubic bone, and then you want to ask the patient to let their legs and knees go into abduction, so into like a butterfly or a frog leg position, and you maintain that vector towards the pubic bone that the whole time as their legs are abducting until they're all the way out, and then you ask the patient to straighten their legs. For a superior nominate shear, you contact the ankle to move the leg, and you slightly abduct just to localize motion up to the ilia and create a traction force directed all the way to the SI joint. And once you maintain that traction, you would continue the traction while internally rotating the leg and doing a little bit of adduction to mobilize the sacroiliac joint to treat a superior nominate shear. When treating a left anterior nominate with still technique, you're going to take the patient's left leg, monitor the SI joint, and take a point to a point of neutral where you've got some play in the joint. You're going to add compression down to your monitoring hand, and then take the leg medially and across while maintaining that vector of pressure the entire time. For a left posterior innominate rotation, the same initial setup, except for this time when you get your compression vector, you're going to go in a motion outward with the leg to rotate the innominate in that direction. So again, stabilize, monitoring hand, take it to a neutral, and you're going to compress and move into an abduction position as you articulate the joint. For a left unilateral sacrum, you'll stand on the patient's left side and contact the opposite leg, a bent knee, and then you initiate your compression vector from that opposite right knee towards the left SI joint, and from that externally rotated abducted position, you're going to take the knee across, medially adducting and maintaining compression, and then straighten the leg to articulate the SI joint. For a diagonal sacrum, you're going to put the legs on the side of the diagonal. So for a right diagonal sacrum, you want the knees pointed towards the right to mobilize the sacrum along that axis. Initiate a compression force down to the sacrum, reverse the axis by twisting and taking the knees to the left, and then finish by articulating and straightening the knees all the way until the legs are straight.